Can a city of dreams become a nightmare for its most vulnerable? In Los Angeles, where Hollywood's sparkle casts a long shadow over 72,000 people live without a home, their struggles drowned by the hum of wealth and fame. The fentanyl epidemic tightens its grip, turning despair into a deadly cycle. According to the Los Angeles Homeless Services Authority in July 2025, 72,308 souls navigate this crisis in Los Angeles County, a slight drop from 75,312 in 2024. These numbers whisper tales of resilience and loss, urging us to confront a challenge that tests our humanity. Let's walk through the heart of this struggle together. The roots of darkness. Why homelessness endures. In Los Angeles, a city aglow with Hollywood's promise, over 72,000 people live without a home, their struggles eclipsed by the city's wealth.
They think that I'm just a broke, don't give a homeless person, and that's not true. I just try and survive, man. Survive the best way I know how. One thing I do need to know is, I hope this little segment or whatever this is does some good for somebody. I hope they see it, they realize what the is going on, and back out of it before they get stuck.
This crisis of homelessness in America, starkly evident in Los Angeles, stems from a tangle of economic, personal, and systemic failures. The cost of living has soared beyond reach. Between 2019 and 2023, rents climbed 22%, while incomes rose only 10%. A minimum wage worker must labor 80 hours a week to afford a one-bedroom apartment, an impossible feat. A shortage of 500,000 affordable housing units leaves families, veterans, and workers with nowhere to turn but the streets. Personal crises deepen this tragedy. A single stroke of misfortune, job loss, a crippling medical bill, or domestic violence can unravel a life in moments. In 2025, the Los Angeles Homeless Services Authority LATSA reports that 21% of the homeless population, roughly 9,035 individuals, battle substance use disorders, while 22% grapple with severe mental health issues. These are not mere numbers, but people trapped in despair's grip. Systemic inequities further tighten this hold. African Americans, just 8% of Los Angeles County's population, represent 33% of its homeless, a legacy of redlining, discriminatory lending, and job barriers that persist across generations. Why does such suffering endure in a nation of abundance? The answer lies in systems that too often favor profit over humanity. Housing development lags far behind need, and the end of COVID-era eviction protections in 2023 exposed thousands to the streets. A recent documentary, Los Angeles Shadows of Hope, lays bare this truth, showing lives undone by choices made or ignored by those in power. For an older generation that cherishes fairness, this crisis demands reflection. How can we allow such inequities in a city of plenty? The roots of homelessness, economic hardship, personal loss, and systemic bias reveal a society at a crossroads where action or apathy will shape the future. A lethal shadow fentanyl's grip on Los Angeles. In Los Angeles, from the sunlit boardwalks of Venice to the quiet streets of the San Fernando Valley, fentanyl has become a silent killer, tightening its hold on the city's homelessness crisis. This drug, 50 to 100 times stronger than morphine, weaves a web of destruction through countless lives. In 2024, the Centers for Disease Control and Prevention found that fentanyl caused 70% of drug-related deaths in Los Angeles County, taking roughly 1/200 lives. For the homeless, the toll is even heavier. 60% of their drug deaths are linked to fentanyl, according to the Los Angeles County Coroner's 2024 report.
So I was so hurt and upset, and just like I wanted to die. And I snorted the whole bag of fentanyl. I overdosed. They had to give me 2 things of Narcan, and eventually I woke up sick as a dog.
Picture Jakey's Manson, a South Los Angeles warehouse worker, until 2022, when he lost his job and home. On the streets, fentanyl sold for just $5 a dose, offered a brief escape from pain, but soon became a trap. His story, shared in the documentary Los Angeles Shadows of Hope, mirrors a wider tragedy. In 2025, the Los Angeles Homeless Services Authority reports that 35% of the homeless population, over 25,000 people, use fentanyl regularly, up from 21% for other drugs. Addiction cuts deep, stripping away jobs, family, and hope. For Jakey's and others, it brings risks of overdose diseases like hepatitis C and street violence, making escape from homelessness in America feel like a fading dream. The drug's shadow stretches far. Neighborhoods near encampments from Hollywood to downtown see more theft and fear, partly driven by fentanyl's spread. Hospitals are overwhelmed with a 40% jump in fentanyl-related emergency visits among the homeless from 2023 to 2024. Yet help is scarce. Only 10% of addicted homeless individuals get treatment like methadone or buprenorphine per 2025 LA County Health data. Why does a city so rich struggle to fight this deadly drug? The answer lies in tangled problems, poverty, too few homes, and systems that overlook the vulnerable. Fentanyl becomes a desperate refuge for those with nowhere else to turn.
I've lost a lot of my friends out here from fentanyl being put in the crack cocaine. I found my one friend dead in the alley.
Documentaries like Los Angeles Shadows of Hope shine a light on this heartbreak, showing lives lost to addiction's grip. For an older generation that values compassion, this is a call to care. Los Angeles must tackle not just the drug, but the despair that fuels it, offering treatment and hope to those caught in the crisis. Only then can people like Jackie's find a path back to a life of dignity. Enduring the shadow's life on Los Angeles' margins. Walk the streets of Los Angeles, from the neon glow of Hollywood to the sun-bleached boardwalks of Venice, and the homelessness crisis reveals its raw, unyielding truth. In February 2025, the Los Angeles Homeless Services Authority, LASA, reported 47,413 people living unsheltered across Los Angeles County, a 9.5% drop from 2024, with 24,895 finding refuge in temporary shelters. Within the city, 26,972 remain without shelter, a modest improvement. These numbers hint at progress, but they veil the relentless struggle of those caught in the crisis of homelessness in America, where survival is a daily battle against despair. Who are these individuals hidden in plain sight? They are not a faceless mass, but a diverse tapestry of lives unaccompanied minors, down to 56 from 106 in 2024. Young adults aged 18 to 24, families, veterans, and immigrants, each carrying their own burdens. In neighborhoods like Metro Los Angeles and South Los Angeles, hotspots of need, 40% of the unsheltered sleep rough, without even a tent or car to shield them. Exposed to harsh weather violence and the pull of fentanyl, their endurance is a testament to human resilience. Yet the cost of this life is staggering. In 2023, over 900 homeless individuals died in Los Angeles, felled by overdoses, untreated illnesses, or accidents with fentanyl playing a merciless role. The youngest bear the deepest scars. In 2024, nearly 150,000 children faced homelessness. For at least one night, their education disrupted their spirits, marked by trauma. These are not just statistics, but stories of dreams, deferred of families torn apart on the streets of a city famed for opportunity. A recent documentary, Los Angeles Shadows of Hope, captures this heartbreak, showing children clutching tattered backpacks and veterans sleeping on benches, their lives a stark contrast to the city's glamour. What does it mean for a society to leave its most fragile to fend for themselves? This crisis unfolding from Skid Row's tent-lined alleys to Venice's crowded boardwalks is more than a policy failure. It's a test of our empathy. For an older generation that values compassion, these stories demand reflection. The streets of Los Angeles bear witness to lives balanced on the edge, where every day survived is a quiet triumph, and hope remains a fragile, flickering light. To watch these souls endure is to confront our own responsibility to demand change, to ensure no one is left behind in a city so rich with possibility. Sparks of hope, striving to end the crisis. In Los Angeles, where the homelessness crisis casts a heavy shadow, faint sparks of progress offer cautious hope. Since declaring a state of emergency in December 2022, Mayor Karen Bass has led with a resolve, launching the Inside Safe program to transform the city's response. By July 2025, this initiative has moved over 21,600 people from sprawling encampments into temporary shelters, clearing more than 100 sites across Los Angeles, according to the Los Angeles Homeless Services Authority, LAHSA. This effort has cut the number of unsheltered individuals in the city by 17.5% since Bass took office, a modest yet meaningful step. For those once huddled on the streets of Hollywood or Venice, this marks a fragile first chance at stability, a glimpse of a life reclaimed. Yet temporary shelters are but a stepping stone. True change demands permanent homes, and Los Angeles is rising to the challenge. In 2024, the city placed 27,994 people into permanent housing, a record achievement driven by Measure HHH, a 2016 voter-approved bond funding thousands of affordable units. Projects like Barrington 1503 in West Los Angeles weave housing with community spaces, creating havens where families and individuals can rebuild. Equally vital is confronting the fentanyl crisis, a scourge fueling homelessness in America. In 2025, Los Angeles County opened 5 new treatment centers offering methadone and buprenorphine to combat opioid addiction. LASA data shows that 15% of homeless individuals battling fentanyl addiction, up from 10% in 2024, now access these programs, though the need far exceeds capacity. Each person helped is a story of hope, but thousands more await their chance. Technology is reshaping the fight. LASA's real-time database tracks shelter beds and service outcomes, ensuring resources reach those in need. Predictive analytics pinpoint individuals at risk of homelessness or fentanyl overdose, allowing early intervention. These tools, showcased in the documentary Los Angeles Shadows of Hope, highlight the power of data to save lives. Yet a question looms: can these efforts grow fast enough to outpace a crisis claiming lives daily? Progress is undeniable. Fewer tents line the streets, more families find homes. But it hinges on sustained funding and political courage. Community support is crucial too, as resistance to shelters and treatment centers often slows change. For an older generation that remembers a time of collective action, this is a call to rally behind solutions. Los Angeles stands at a turning point where commitment and compassion can light the way to a future where no one is left on the margins. Shadows on the horizon, barriers to lasting change. In Los Angeles, the battle against homelessness faces steep hurdles that threaten to dim even the most promising efforts. A primary obstacle is the city's fragmented coordination among agencies. Despite initiatives like Inside Safe, overlapping jurisdictions, and bureaucratic red tape slow the delivery of services. In 2025, only 25% of homeless individuals accessing outreach programs receive follow-up care within a month per Los Angeles Homeless Services Authority, LASA data, leaving many stranded without sustained support. This disjointed system frustrates efforts to address the fentanyl crisis, as addiction services often fail to reach those in need, prolonging their struggle on the streets. Another challenge is the lack of public trust in long-term solutions. Many residents skeptical of government efficiency hesitate to support bold reforms. A 2024 survey by the Los Angeles Times found 60% of voters doubt that increased funding would effectively reduce homelessness, citing past inefficiencies. This skepticism stalls critical initiatives such as expanding mental health clinics to combat fentanyl addiction. Policies like the 2025 Los Angeles Ordinance limiting public space usage for encampments have also sparked backlash. Critics argue these rules displace the homeless without providing viable alternatives, driving some to rely on fentanyl to cope with increased instability. Economic headwinds further complicate progress. Soaring land prices and zoning restrictions in 2025 hinder affordable housing development, with only 35% of Measure HHH projects meeting deadlines due to regulatory delays. Gentrification in neighborhoods like Boyle Heights pushes low-income families out, adding to the homeless population. The documentary Los Angeles Shadows of Hope captures this pain, showing residents forced from their homes as luxury developments rise. These economic forces create a cycle where the vulnerable are squeezed out of stability. How can Los Angeles move forward when distrust, bureaucracy, and economic barriers stand in the way? Addressing homelessness in America requires a unified approach, streamlining services, rebuilding public confidence, and prioritizing human dignity. For an older generation that cherishes community and fairness, this crisis demands action. We must advocate for policies that cut through red tape, fund mental health and housing, and protect those at risk. Los Angeles can light the way, but only if we commit to compassion over indifference. A personal reflection, the weight of our choices. Stepping into the heart of Los Angeles' homelessness crisis, I'm struck by its human cost. Each statistic hides a story like Jackie's Manson, a man whose life unraveled into fentanyl addiction after losing his job in 2022. Wandering through Los Angeles' streets from Venice's crowded boardwalks to downtown's shadowed corners, I see not just policy failures, but a moral reckoning. Homelessness in America is no accident. It stems from choices favoring profit over people, neglecting mental health, and allowing inequities to fester. Fentanyl's toll, driving 60% of drug-related deaths among the homeless in 2024, underscores the deadly price of inaction. What lingers is the resilience of those enduring this crisis. Children clutching worn toys, veterans sleeping on benches, families holding on to hope. Despite crushing odds, their strength humbles me. Yet their suffering demands more than our pity. It calls for accountability. Why do we allow such hardship in a city of wealth? We must demand policies that build affordable housing, expand addiction treatment, and confront systemic barriers, like those that disproportionately leave African Americans homeless. The stories of these individuals, brought to life in documentaries like Los Angeles Shadows of Hope, challenge us to act. We cannot turn away from the tents or the faces behind them. For an older generation that values justice, this crisis is a call to action. Los Angeles could lead the way, showing the nation how compassion and innovation can heal even the deepest wounds. If we prioritize dignity over indifference, we can rewrite these stories, offering not just shelter, but hope. This is our shared responsibility to ensure no one is left to fade in the city's shadows. A vision for tomorrow, ending the crisis. The path to a Los Angeles free of homelessness is arduous, but not impossible. Immediate action is critical: expanding affordable housing, increasing access to fentanyl treatment, and prioritizing vulnerable groups like youth and African Americans. Programs like rental subsidies and eviction prevention can stop the slide into homelessness before it begins. Long-term, the city must aim for functional zero, a state where homelessness is rare, brief, and non-recurring. This requires bold reforms in housing, employment, and healthcare, coupled with innovative models like the Skid Row Care Campus, which integrates housing treatment and support services. Collaboration is key. Government, nonprofits, and private sectors must align to scale solutions. Community resistance must give way to collective responsibility, recognizing that homelessness in America affects us all. Technology, from predictive analytics to real-time data, can guide these efforts, ensuring resources reach those in need. Above all, we must restore dignity to every individual, acknowledging their stories and struggles. Why should any child sleep on the street in a city of such wealth? Los Angeles can lead the way, transforming despair into hope.